Hello, everyone, and welcome to our most urgent English lesson yet. Today, we're rushing to the emergency room with Emma as she experiences a medical scare with John by her side. You'll learn essential medical English, how to describe symptoms, communicate with healthcare staff, and handle emergency situations confidently. This could be the most important English lesson you ever take. Let's begin.
John, I'm starting to feel really strange. My chest feels tight and I'm getting dizzy. I think I need to lie down for a minute.
You've gone pale. Are you having trouble breathing? I think we should head to the emergency room right now. Better safe than sorry.
Maybe you're right. I'm experiencing sharp pains in my arm, too. Should we call an ambulance or can you drive me to the hospital?
Let me grab our insurance cards and I'll drive. It's faster. Can you walk to the car or do you need help?
I can walk, but please hurry. The pain is getting worse and I'm starting to feel nauseous, too.
Okay. Deep breaths. I'll get you to the hospital in 10 minutes. Just try to stay calm and keep talking to me on the way.
Notice Emma said feel really strange. We use feel plus adjective to describe physical sensations. This is the most common way to express how your body feels. John's question, having trouble breathing, uses the continuous form because it's about a current, ongoing difficulty. We use having trouble plus ing verb for current challenges. When Emma mentioned experiencing sharp pains, she used a more formal medical term. Experience is often used in healthcare settings for symptoms. John's instruction, try to stay calm, uses try to plus verb for gentle suggestions during stress. This is much softer than saying stay calm. The phrase getting worse shows deterioration using get plus comparative adjective. Very important for describing changing medical conditions. Finally, keep talking to me uses keep plus ing to encourage continuing in action, essential for maintaining communication in emergencies. Now, let's practice these medical phrases. I feel really dizzy today. She's having trouble sleeping. He's experiencing back pain. Try to remain still. The fever is getting worse. Keep drinking water. Excellent! You're learning potentially life-saving English.
We need help. My friend is having chest pains and feeling dizzy. Where should we go for emergency care?
Please have a seat in the waiting area and I'll get you the registration forms. Meanwhile, can you tell me her main symptoms?
I'm experiencing tightness in my chest,
pain down my left arm, and I keep feeling like I might faint. Okay, I'm calling the triage nurse right now. She'll take your vital signs before you see the doctor. Can you provide your insurance information?
I have our insurance cards right here. Should I fill out these forms while we wait for the nurse?
Yes, please complete all sections about medical history and current medications. The nurse will be with you shortly. Thank you. I'm trying to stay calm, but the pain is coming in waves. Should I be worried about a heart attack? The nurse will assess your condition immediately. Just try to breathe slowly and deeply. Help is on the way.
Notice the receptionist said, "Please have a seat." This is the polite imperative form for giving instructions in professional settings, very common in healthcare. When John said, "having chest pains," he used the continuous form to describe current ongoing symptoms. We use having plus body part plus pain for current discomfort. Emma's description, "pain down my left arm," uses the preposition down to indicate radiation of pain. This is medically important for describing symptom patterns. The phrase "coming in waves" describes intermittent symptoms that increase and decrease. We use this for pain, nausea, or other cyclical systems. The receptionist's instruction, "try to breathe slowly," uses try to plus verb for gentle medical advice, much more compassionate than commands. Finally, assess your condition is formal medical terminology. Healthcare professionals assess while patients describe their symptoms. Now, let's practice these hospital phrases. Please have a seat in the waiting room. She's having abdominal pain. The pain goes down my leg. The nausea comes in waves. Try to relax your muscles. The doctor will assess your injury. Excellent. You're learning to navigate healthcare situations in English.
Hello, I'm Nurse Sarah. I understand you're feeling unwell. Let me take your blood pressure and check your heart rate first. When did you start experiencing these symptoms?
About an hour ago, I was having dinner when I suddenly felt this tightening in my chest. The pain has been coming and going since then.
On a scale of 1 to 10, how would you rate the pain? And are you experiencing any shortness of breath or nausea?
She mentioned feeling nauseous in the car. Should I step outside while you examine her?
You can stay right here. Emma, I need you to describe the pain. Is it sharp, dull, or burning? Does it radiate to any other areas?
It's a pressing kind of pain, like someone's sitting on my chest. And yes, It spreads to my left arm and jaw.
I'm noticing your heart rate is elevated. Let me get the doctor immediately. Please try to remain as still as possible.
Notice the nurse asked, "Feeling unwell." This is a professional way to ask about general sickness without being too specific, common in medical settings. Emma's description was having dinner, used the past continuous to set the scene when symptoms began. Perfect for telling medical histories. The phrase "has been coming and going" uses present perfect continuous to describe recurring symptoms over time, very important for symptom timelines. When the nurse asked, "Rate the pain," she used the verb rate for numerical assessment. Healthcare professionals often use 1 to 10 scales for pain evaluation. Emma's description was pressing kind of pain, uses adjective plus kind of to categorize pain types. Doctors need these specific descriptions. Finally, "it spreads to my left arm," uses the verb spread for pain radiation. This can indicate serious conditions that need immediate attention. Now, let's practice these medical assessment phrases. Are you feeling unwell today? I was watching TV when the pain started. The dizziness has been coming and going. Rate your discomfort from 1 to 10. It's a stabbing kind of pain. The numbness spreads to my fingers. Excellent! You're learning to communicate symptoms like a healthcare professional.
Hello, Emma and John. I'm Dr. Rodriguez. We've reviewed your test results and checked your heart monitor. The good news is you're not having a heart attack.
Oh, thank goodness. But what caused all these symptoms? I was so scared I might be having something serious.
You're experiencing a severe panic attack combined with acid reflux. The chest tightness and arm pain are classic symptoms of anxiety, and the reflux explains the nausea.
A panic attack? But she's never had anxiety issues before. What could have triggered this sudden episode?
Sometimes stress builds up over time and manifests physically. We'll prescribe medication for the reflux and refer you to a therapist for the anxiety. You should start feeling better within a few hours.
I can't believe it was anxiety. I was convinced it was cardiac. Should I make any lifestyle changes to prevent this from happening again?
I recommend reducing caffeine, practicing deep breathing exercises, and managing your work stress. We'll schedule a follow-up appointment next week to check on your progress.
Important medical communication vocabulary from that diagnosis scene. Let me explain these essential healthcare phrases. Notice Dr. Rodriguez said, "reviewed your test results." This is the professional past tense for discussing completed medical analysis, very common in diagnoses. Emma's relief, "so scared I might be having," uses "might be having" to express fear about a possible current condition, perfect for discussing health anxieties. The phrase "classic symptoms of" is medical terminology for typical indicators of a condition. Doctors use this to explain diagnosis reasoning. When John asked what triggered this sudden episode, he used medical vocabulary for cause and effect in health situations. Trigger is key for sudden onset conditions. Dr. Rodriguez's advice, builds up over time, describes gradual development of health issues. We use build up for accumulating stress or symptoms. Finally, prevent this from happening again uses prevent plus from plus ing for avoidance language, essential for discussing health maintenance. Now let's practice these diagnosis phrases. We reviewed your blood work. I was worried I might be sick. These are classic signs of infection. What triggered your allergic reaction? Stress builds up over months. Exercise can prevent heart disease from developing. Excellent! You're learning to understand and discuss diagnoses in English.
Here's your prescription for acid reflux medication. Take 1 tablet before eating breakfast each morning. I've also included information about managing anxiety symptoms.
Thank you. Should I avoid any foods or activities while taking this medication?
Limit spicy foods and caffeine for the first week. If you experience any side effects, like dizziness, contact your doctor immediately.
We'll follow all instructions carefully. Is there anything else we should know about her recovery?
Get plenty of rest this weekend and try to reduce stress. The medication should help with the physical symptoms quickly.
I'm already feeling much better. The tightness in my chest has almost completely disappeared. Thank you for staying calm through all of this. I don't know what I would have done without your help today.
That's what partners are for. Now, no more worrying about work or deadlines. Your only job is to get better and relax.
Essential recovery and pharmacy vocabulary from that final scene. Let me explain these important healthcare phrases. Notice the pharmacist said, prescription for acid reflux. We use prescription for plus condition or medication type. This is standard pharmacy terminology. Emma's question, avoid any foods, uses avoid for strong recommendations against something. Healthcare professionals often use this for restrictions. The phrase, taking this medication, uses the continuous form because medication is an ongoing process. We use taking for regular medicines. When the pharmacist said limit spicy foods, she used limit for partial restrictions rather than complete avoidance, common in dietary advice. John's promise, follow all instructions, shows commitment to medical advice. Follow instructions is crucial for proper recovery. Finally, focus on recovering uses focus on plus ing verb to emphasize priority actions during healing periods. Now let's practice these recovery phrases. This prescription is for antibiotics. Avoid strenuous exercise this week. She's taking pain medication. Limit screen time before bed.
Always follow your doctor's instructions. Focus on recovering completely. Excellent! You've mastered essential medical English from emergency to recovery. And that completes our emergency room adventure. You've just learned crucial medical English that could truly make a difference in real-life situations. From describing symptoms to understanding diagnoses and pharmacy instructions, you now have the vocabulary to handle healthcare emergencies confidently in English. Remember, medical English isn't just about words. It's about clear communication that can lead to proper care and even save lives. Download your free Medical English PDF in the description below, complete with all the vocabulary, phrases, and exercises from this lesson. Join us next time for another exciting English adventure. Until then, stay healthy and keep practicing your English skills. Remember, good health and good English go hand in hand. See you in the next lesson.